We're going to start this week with patient care review for ART. And just remember it's about 33 questions on the test. Where should you start? You should start with the content specifications. So on ART, they have the content specs posted. Print out the specs, or I've already given them to you, and separate out the patient care sections. I recommend doing them in order as they're listed. So part 1 is patient interactions and management, and then I would focus on this number 1, or A, letter A, ethical and legal aspects, and then follow through this list, and then start with number 2, which is legal issues. Number 3 would be standard of ethics. So if you're looking for a way to organize your studying, I would start how they have them listed and follow through those. Okay, all the way through to over here. All right, so ART patient care tips. I want you to think of health science class, basically your patient care class. Communication is key. Go with common sense, right? And what should be done, and if you're given a situation, what should be done to kind of keep the patient the safest. Know the standard, know the protocol for the department. What would we do? Don't fall for the traps of practice, but think, what should I do at clinical if this situation arises? Patient care keywords, they're also procedures keywords, would be trauma, a geriatric patient, a pediatric patient. Something like that should tell you that maybe this patient needs some flexibility, or I have to alter how I normally would do this exam. How would I treat my family member, my grandmother? How would I like to be treated? Essentially are, kind of your guidelines for patient care questions. All right, so we're going to start with patient's rights, and specifies consent as written, oral, and implied. Think your invasive procedures. So for us, for say arthrograms or myelograms or things of that nature, that's an invasive procedure. It needs a written and signed consent form. It's the physician's responsibility to give the patient all the information and to make informed consent. So they need the patient to be informed. They have to go over all the risks with them prior to the procedure, and they have to sign off on it. As far as non-invasive, so your regular x-rays, right? Those are non-invasive. We don't do a written consent form. Essentially, it's oral consent. If you explain the procedure, we're going to do some x-rays of your right foot. They follow your instructions. That indicates implied consent. So some things to remember. So confidentiality, if you remember HIPAA. HIPAA has 2 A's if you think Alcoholics Anonymous, all right? Privacy. So you are going to receive privacy practice notices. You probably receive them for all the forms that you fill out at the doctor's office that you just sign and probably don't read. But as far as privacy practices, there's restriction on using the personal health information. You might see it abbreviated as PHI. Extent of care, you're allowed to either consent or refuse treatment. A DNR could be an example. Autonomy. I want you to know this word. Autonomy is your right to refuse medical treatment. You get to decide what happens to you. Sort of a gray area might be pediatrics. If you're under a certain age, your parent or guardian will need to make those decisions for you. Access to information. You have a right to review medical records. Documents expressing patient's wishes. I would like you to know the differences. So you're going to look up living will, healthcare proxy, and advanced directives to know the difference between the two. Regards to research participation, the patient has the right to consent or decline participation in research. Patient rights. So if you have heard the Patient's Bill of Rights from the AHA or American Hospital Association Patient Care Partnership, it is now replaced with patient care partnership. What can you expect? And you've probably seen these pamphlets maybe at your doctor's office or at the hospital. But what should you expect as far as patient care? You should expect high quality hospital care, clean and safe environment, involvement in your care, protection of your privacy, help when leaving the hospital, and help with billing claims. Clinical and legal aspects. So the orders, your radiology orders must be written by a doctor or his or her agent. The ordering doctor is responsible for ordering the correct exam, and results are directed to that ordering physician. Your requirements for information there are 5. So the patient, who is going to be examined, the exact region or part. They have to have a specific suspected or existing patient diagnosis. So on our orders, it'll say clinical question. It'll say clinical question pneumothorax, clinical question fracture, something like that. It also has to have a date on it, and it has to have, for us, it has to have the physician's signature. And then verification and patient identification. I know we know this, right? 2 patient identifiers, and we have to check the correct side and the correct body part to be examined.